In this video, we're going to be looking at the role we can play in general health promotion. So we've spoken quite a lot up to this point about oral health promotion and the role that therapists have in that and how we can be involved in the planning and delivery of oral health promotion. But now I want to look a little bit wider, a little bit more holistically at how we can be involved in the promotion of government strategies to improve overall health and not just the health of the mouth. So this is going to link in a little bit with what you've been learning in human disease. We often describe the mouth as the window to the body. And what we mean by that is you can see things in the mouth that are reflecting your overall health. Quite often we have oral manifestations of systemic diseases. And also we have oral diseases that can affect our systemic health. So it's very much a two-way process in terms of our oral health and our general health. So if we think a little bit about conditions that affect our general health that will also have an effect on our mouth, think first of all maybe about chronic bowel inflammatory disorders, so things like Crohn's disease, celiac disease, and even things like eating disorders. They can really affect the health of our mouth. So all these conditions leave us at a point where we're suffering with malnutrition, whether that because we have an eating disorder and we're not taking in the basic nutrients that we require, or because if you have a chronic inflammatory bowel condition, you may be eating the things that you require, but you're not able to absorb the minerals and vitamins that come from them. So you often see manifestations within the mouth, things like ulceration, cobblestoning mucosa, glossitis. So it may be that the person has not yet been given a diagnosis. Maybe they're aware that they've got problems with their stomach, but they've not sought any information about it. Spotting these kind of signs in their mouth may be a way of highlighting to the patient they've got a problem. On the other hand, it may be if the patient's suffering with something like an eating disorder, you can see direct effects on the teeth. So effects of acid erosion, and also sometimes some marking in the palate or the throat if there's vomiting going on. So that's a condition affecting a remote part of the body, but they certainly see effects within the mouth as well. The next thing to think about is cancer care patients. So patients who've got cancer, whether that be head or neck or anywhere else for that matter, will be receiving a number of treatments. And those treatments can be very difficult for patients. Chemotherapy and radiotherapy are designed to target the cancer cells and stop their reproduction. However, it will also affect a lot of tissues in the area in the case of radiotherapy, and in chemotherapy it can affect tissues throughout the whole body. The patient having cancer care treatment, as you'll have discovered or will discover when you do it in human disease, often experience really unpleasant oral symptoms. Mucositis, so inflammation of the oral mucosa. It's painful and there can be swelling. You can affect your taste, affect your ability to swallow, dry mouth, all these kind of things. So cancer care patients are a group of patients that are often referred to special care dental services for the time that they're having their care and also for the rest of their life for long-lasting effects. One that you'll have spoken about a lot, even in first year, is patients with diabetes. And diabetes has this cause and effect relationship with periodontal disease. We know that uncontrolled diabetes makes periodontal disease worse, but also the pathogens involved in periodontal disease have been found within remote parts of the body that are worsening the diabetes as well. So poor diabetic control leads to poor periodontal control, but poor periodontal control can also lead to poor control of the diabetes. So it's very much a relationship that needs to be had between multiple disciplines to be able to improve the patient's situation. And then the last one I wanted to mention just now is blood disorders. So we could be looking at things like leukemia or bleeding disorders, or we could be looking at autoimmune disorders of the blood, so things that may be carried in the blood like HIV or hepatitis. These are conditions that both cause oral manifestations, but also poor oral health may well contribute to the worsening of that condition. If you've got a chronic inflammatory condition in your mouth, such as periodontal disease, it reduces your body's ability to be able to fight the pathogens that are involved in those kind of conditions. So what we're getting at here is that there's a very clear link between the body and the mouth. And for those reasons, it's very important that we can help people look after their overall health and not just the health of their mouths. Sometimes we get a bit too focused on looking in a person's mouth and we forget that there's a body attached. So promoting good oral health and promoting good general health should go hand in hand, because one will affect the other. So the Scottish Government in 2008 has published 5 linked public health strategies. They are looking in particular at tobacco, alcohol, substance misuse, diet and obesity, and physical activity. And as a whole, these public health strategies are being implemented to try and improve the health of our nation. Now, any government has public health strategies in place. These are large national programmes, sometimes international, depending on where it is that we're talking about. And they are set out at a government level with high budgets to try and target the issues that are causing particular problems for that nation. The reason why these are really important to us is because these are things that we need to be aware of in order to be able to do our job. These are the policies that tell us the kind of advice we need to be giving to patients. So just like we look at things like SDCP and SIGN guidelines to give us our guidelines for treating oral conditions, these are the type of guidelines that we look at to look at the ways in which we should be managing other conditions that are affecting our general health. These 5 policies have been deemed to be the most significant risk factors for people living in Scotland, and probably for most of the Western world, realistically. So I'm going to take you through a couple of these, but I really want you to take some time to follow the links that I've given you on Blackboard to go and look at the other ones as well. Some of them are not quite ready for publication yet, so it was supposed to be a 2018 implementation. Some of them have taken a little bit longer. So, for example, at this point, the alcohol prevention or alcohol management strategy hasn't been released yet. So it may take a wee bit of time for them to filter through, but the plan was for the Scottish Government to publish these in 2018. So the first one I thought we'd just have a brief look at is Improving Scotland's Health, and it's a Healthier Future, Scotland's Diet and Healthy Weight Delivery Plan. And this has come off the back of the previous action plan, which was the Scottish Diet Action Plan, and it ran up until 2003, and then between 2003 and 2005 they did some evaluation of the programme, looked at how it had gone and saw where improvements could be made. So this action plan has come up with 5 outcomes that it's wanting to look to work towards. And the reason why they've come up with these outcomes is because there's some quite shocking statistics that are still around within Scotland. So 2/3 of adults in Scotland in the 2016 Scottish Health Survey were reported as being overweight. So that's 65% of the adult population. And 29% of the overall population were actually obese. So that's a huge proportion of our society that have got issues with weight. And then if we look at children in particular, the Scottish Health Survey again in 2016 described 29% of children as being at risk of being overweight and 14% of children at risk of obesity. So it's a really, really dramatic issue. And we know the number of issues that are involved with patients who are overweight. The estimated cost to the NHS within Scotland in 2016 of managing the particular conditions that occur as a result of obesity ranges somewhere between 363 million to 600 million pounds. And that's just the NHS direct effects. If you look at the economy as a whole, so thinking about things like the amount of time people have to take off work because of obesity-related illnesses and so on, we're talking about up to £4.6 billion in 1 year. So it's a huge impact on our society, hence why the government have made it such a priority to put a nationwide improvement programme into place. So the 5 outcomes that they've come up with, I'll just very briefly go through them. Again, you can have a look at it yourself. In terms of outcome 1, which is about managing childhood obesity, the aim is to have half childhood obesity by 2030. And in order to do that, there's a lot of strategies in place, as you can see there, but it's talking about supporting women with breastfeeding, giving early years advice to parents as they're weaning their children, frontline staff training, so dealing with people who work in schools, for example, to try and help educate them on the management of children's diet, but also educate the children themselves, and then later on education of the children so that they can make healthy choices later in life. The second outcome is about creating a food environment that supports healthier choices. A lot of this is to do with the way large companies that produce foods that are high in fat and sugar, the way they market their products. There's already been some steps made to try and reduce the amount of fat and sugar in products. You might be aware, for example, that Iron Brew recently changed their recipe so that it was actually half the sugar that was in it before. So some of those things are already in place, but it's also looking at advertising, restricting when advertising can be happening for these kind of products, keeping it away from children's TV, for example, possibly moving it to after the 9 o'clock watershed. Try and stop the promotion of these unhealthy foods that are high in fat and sugar. So things like bulk buys, buy one get one free, trying to reduce that. Rewards. You used to get things like if you saved up a number of coupons on a packet, you would get some kind of reward. All those type of things have been removed now to stop encouraging people to buy those kind of products. It also interestingly looks at things that are people who are endorsing these products, so trying to make sure we don't use say celebrities, for example, that are highly influential for children in the advertising of these kind of products that we know will be harmful and for particularly easily influenced groups of society. Outcome 3 is about access to effective weight management programmes. So things that we might know of as Scottish Slimmers or Weight Watchers, for example, whilst they may seem accessible, there is a cost involved, and for a lot of people that's quite significant. And if we look at the groups of people that suffer with weight and obesity problems, it's in the same way as there are health inequalities across all, it's the same with this. So 32% of adults in most deprived areas are obese compared to only 20% in the least deprived of areas. So what the government is going to try and do is try and help these people in the most deprived or the most high-risk groups to access these effective weight management services. So things like targeting patients with diabetes, because we know there's a clear link between type 2 diabetes and weight. Continuing to fund health board weight management programmes. You may or may not have seen these advertised, but things like NHS Healthy Walks programmes, things like that, to try and encourage you to take a wee bit more exercise. Also help facilitate weight management programmes in schools, so weight monitoring and management. And also just to try and remove some of the stigma that goes along with going to these kinds of groups. Some people still feel a bit awkward about going to weight management groups, and it's just to try and remove that, because we know that those groups are the most successful way of losing and maintaining weight loss. The fourth outcome is looking about leaders across all sectors promoting a healthy diet. So this is sort of like public sector setting a good example. So it's looking at the food that's served in public sector, so things like hospitals, sports centres, schools, making sure it's appropriate healthy food to try and reduce our issues with weight and obesity. Reducing food poverty. This is a really important point, because healthy food that is low in fat and sugar is often the most expensive or perceived to be the most expensive option. And if you are working on a very tight budget, it may be very difficult for you to access those kind of foods. And the foods that are quick and easy to prepare are often the ones that you might be leaning more towards if you are short of time because you're having to work excessive hours, for example. And those are the kind of foods that then lead to problems with our diet. So trying to reduce food poverty to allow us to be able to access the best possible options for us. And it's within this outcome 4 that they also talk about students and looking at students' diet. Typically, we all know that students have a very poor diet. You may or may not fall into that category. But again, a lot of that's to do with money and food poverty. So the aim is that these 4 will all come together to help produce outcome 5, which is to reduce diet-related health inequalities, to get everybody to have the same opportunities to get themselves to a healthy weight and diet programme. So the other part of improving Scotland's health policy that I wanted to look at was the tobacco policy or tobacco-free policy that has been developed. So Raising Scotland's Tobacco-Free Generation is the action plan that's been produced in 2018. And it is aiming towards achieving a reduction in smoking rates to less than 5% by 2034. Our smoking rates have decreased dramatically. In 2013, we reached a really key point in Scotland where the number of ex-smokers outweighs the number of current smokers. So, I mean, that's really, really positive. Also, we've had a significant fall in the amount of second-hand smoke exposure. So, for example, there's been campaigns to stop people smoking in their car when they've got their children in their car and things like that. So second-hand smoke exposure has been reduced. However, we do still have a significant issue with smoking. It still is the cause of around 1 in 5 deaths in Scotland. And so smoking kills 2 of every 3 long-term smokers in Scotland. So it really contributes massively to a lot of the health problems that we have in Scotland. A lot of our health problems are cardiovascular or pulmonary related issues, and smoking is a massive point of that. So the challenge now is to try and take the facts and the messages that we've been promoting for years and years and try and put them in a way that's going to be effective for this last remaining proportion of society that continues to smoke. People have been given the facts. It's not a lack of education anymore. It's about how we get that message over to people in the most possible, the efficient possible way. So the Tobacco Action Plan has 4 sections that it's looking to work for. The first one is about informing and empowering through raising awareness. So this is about continuing with things like the media campaigns, National No Smoking Day, World No Tobacco Day, the adverts that you see on television, on the packaging, all that kind of stuff, to continue to increase awareness and give people the information they need. Energy Scotland also work with ASH, who are the anti-smoking people organisation within Scotland, and they co-fund their organisation to help promote the information further. This action plan also talks about working with midwives and other carers of pregnant women or women who've recently had a baby to try and help promote the reduction of smoking during pregnancy, because we obviously know that that's a very important aspect of the action plan, is to reduce smoking in pregnancy. And then the other thing we talk about is working with trading standards. There's been a lot of regulations brought into place in Scotland, in particular with regards to the selling of tobacco products, making sure you've got standardised packaging, that they're not advertised or even on show. You'll have noticed nowadays in things like the kiosk at the supermarket where they used to sell the cigarettes, they all have to be behind the screen, so you don't have that temptation of walking past and seeing them. So as part of this action plan, the government will be working with trading standards just to make sure that retailers are completely aware of the policies that are in place now, and in circumstances where traders are considered to be acting out with that legislation, managing that. The second one is about encouraging healthier behaviour. And a lot of this relates to putting in place and enforcing actions that have been dealt with before. So we already have, for example, policy in place about trying to encourage people not to smoke on NHS premises. However, it's never been particularly well enforced. So this action plan talks about banning smoking around hospital buildings throughout 2018 and making it an actual offence to smoke within 15 metres. So whilst there's been signs up before saying please don't smoke in this area, it wasn't actually a legal offence. So throughout 2018 that's going to be implemented. Also looking at people who provide housing, so local authorities and housing associations, and making sure that they have things like tobacco-free clauses within their tenancy agreements, so you're not going to be allowed to smoke within those properties. Improving services for smoking cessation is a really important part of this action plan for dealing with tobacco use in Scotland. It's been proven in a number of ways now that the most effective way to stop smoking is through using an approved smoking cessation programme. So this part of the strategy aims to continue to fund those processes and also look into the more vulnerable groups that need to be targeted. So the programme, what they're calling it now is Quit Your Way. So that's the government programme to help encourage people to look at the variety of options that are available to them to stop smoking and choose the one that's best for them. So that's going to be really embedded within local and national healthcare policy. We're also going to be targeting things like I said earlier, women who are smoking during pregnancy, people who are accessing mental health services, helping them as more vulnerable people to be able to have access to these services the same as everybody else would. And also looking to implement these services both in the hospitals and also within prisons. A number of times throughout this action plan it refers to smoking within prison services and that's been neglected in the past. And that's looking at the rights of people who are in prison and accepting that they have the right to access these kind of services as well. Perhaps in the past it's been a judgment's been made on their behalf that they wouldn't be interested in this kind of programme, and that's not acceptable. They have the same rights as the rest of us. And then the last thing here is talking about providing protection through regulations and restrictions. So introducing a number of consultations and possible bans to further tighten up the availability of tobacco products. So the Scottish Government is looking to ban possession of tobacco products in prisons, hence why it's important that smoking cessation services are available to them. And that's to protect not only the prisoners who are smoking to try and reduce their use of products, but also the other prisoners. Obviously, if you're within a confined prison environment, the option to go outside to smoke may not always be there. So if we ban the use of products altogether, then it will help reduce the second-hand smoke for people who are both prisoners and also working within prisons. They're also going to consult on the advertising and promotion of e-cigarettes. There's this issue with e-cigarettes at the moment that we've got a sort of limbo between the fact that we know it's probably better than smoking tobacco traditionally, but we don't have enough evidence to suggest it's that much better. And also there's an issue with just replacing one habit with another, and we still are aiming towards a point where patients are not using tobacco products at all. So they start to refer to the e-cigarettes in this document as heated tobacco products. So they're looking to ban the highly flavoured heated tobacco products. So that's to try and discourage perhaps younger people away from using them, and also to introduce standardised packing for heated tobacco products, just like there is for cigarettes. So there's the 4 steps within this tobacco action plan, all working towards the same aim to reduce tobacco use within Scotland. So why am I telling you all this? Obviously, we are dental care professionals. We have a role within general health promotion. It's important that we understand the protocols and the guidelines that are in place in order to provide the best possible care for our patients. So what's our role within all of this? Well, first of all, you've got to know the advice. If we don't know the guidelines that are in place by the government, then we can't possibly promote them, and that's part of our role as the healthcare professionals. So it's very important that we're aware of what's going on at a national level. We also want to assist patients with their behavioural change. So if we think about our nutritional analysis that we do as part of our role as therapists, we are not only looking at the sugar intake of people, but also at their overall diet. And if we can be aware of the guidelines that are in place with regards to reducing high fat and sugar products, then we'll be able to give the right advice and assist people with their behavioural change. Point people in direction of the services that are being provided by national government. So the weight management programmes that we spoke about just before, or the smoking cessation services. It also could absolutely be part of our job to be involved with the research for these policies that are generated, evaluating the success of the policies, and possibly even developing the government strategies in the first place. Dental care professionals are part of a wider healthcare team. Sometimes we think that, oh, you've got to be high up, you've got to be working within government already to be part of these processes, and that's not the case at all. The data has to be gathered at a baseline level, and that's gathered out in community, out in general practice, where we either will work or already work. So it's very much part of our role. It's also quite possible that you might choose to move more into the health promotion or the public health aspect of our careers. So don't think of these things as something that other people tell us to do or other people develop and we just follow them. There's every possibility that this is something you might choose to be involved with later in your career. Now, in order to be involved with these kind of policy developments, we start to move into the realm of multidisciplinary teamwork. And multidisciplinary teams are vital in the production of healthcare policy, as well as in the management of individual patients. So multidisciplinary teams can involve a huge number of professionals, hence the term multidisciplinary teams. In order for it to be multidisciplinary, you do need to have more than just one sector involved. So sometimes people get a little bit confused and they think that if you've got a dentist and a therapist and a nurse and a hygienist working together, that's a multidisciplinary team, but it's not. They're all within the one discipline of dentistry. In order to be multidisciplinary, you need to be spanning across the sectors. So you need to be thinking about dental, medical, social care, well-being, and possibly government involvement as well. So there's a huge number of factors, and that's what I'm trying to demonstrate here with this mind map. This is looking more at the sort of medical and dental side of things. So say, for example, we're talking about a patient who's got cancer that we mentioned earlier, who's having cancer care. Well, they're certainly going to have a consultant involved in the overall foreseeing of their care. They're going to have specialist chemotherapy nurses. They're going to have probably seen the dentist before they started their cancer care to help them become dentally fit. Then whilst they're having their cancer care, they may be experiencing these problems with mucositis, in which case that could be your role to help support them through that. They may be struggling with their speech if it was a head and neck cancer, so the speech therapist is going to be there. So you can say these are big teams. And what happens with multidisciplinary teams is you tend to have what we call case meetings, when all these healthcare professionals and else out with as well get together and start to talk about that patient. And these meetings tend to be regular throughout their care, and it really depends on the extent of the issue as to how many people are involved. Unfortunately, dental care is sometimes overlooked by the medical profession, and you often see a big multidisciplinary team working and nobody's thought, oh, hang on, has anybody spoken to the dentist? And that's largely because dentists are often in general practice. There are contractors of the NHS rather than employees of the NHS. So they tend to be very busy people. So busy people and with very expensive time. And that's where we as therapists can be really proactive with our involvement with these patients. We can be going to our practice principal in general practice and saying, I've just seen Mrs. Smith, shall we say, and she's informed me that she's going to have treatment for an eating disorder. She's got a multidisciplinary team. I'd really like to be involved with that. I appreciate that you're a busy person, so how about I take that role within that patient's care team for you? Contact the GP, make yourself known. You do need to be proactive to these things, but it's absolutely working in the best interest of the patient. And that's the whole point of multidisciplinary teams. It's about getting people to talk to each other. And it's something that's been highlighted in the child protection side of things, that not enough teams were talking to each other. So there was the particular case a number of years ago, which was the Victoria Columbia case, where a number of different people, organisations, had noticed that this child was missing or was not in a good way, but they hadn't spoken to each other. So the GP had noticed it, the school had noticed that she was absent, the social worker had been aware that there were issues, but they hadn't all come together. And in the end, that child suffered considerably and actually died as a result of lack of communication. So multidisciplinary teams and everybody getting together and working together is really, really important to promote the best possible outcomes for patients. So we think a little bit more specifically then about how we as therapists can be involved. I've just given a few examples here of the ways in which we can be involved and what role we would play within a multidisciplinary team. So we've mentioned already cancer care and child protection, but if we look to the other side, so a patient with diabetes, we're really importantly placed to work with that patient to help improve both their oral care and their diabetes management. We could be working closely with the patient's diabetic nurse, seeing on a regular basis, to pass information with the patient's permission between you and the diabetic control nurse to help manage that patient. You could be providing diet advice, but you need to make sure that diet advice is consistent with the advice that the diabetic team's been given. And your periodontal management is also important that the diabetic team know what's going on there. So working together to get the best possible outcomes. Mental health teams is not one we've spoken about yet, but that's certainly something we could be part of, and it's not something you might initially think you could help a patient with, but it really is. Patients with mental health problems often suffer with anxiety and possibly phobias. With the right behavioural change and behavioural management tools, we can help a patient get through those anxieties and phobias if they're specifically dental related. We can also really help people with their self-esteem issues. A lot of people are very self-conscious of their smile, and perhaps due to their mental health problems, their oral health has been neglected for a number of years, and it's really helping to bring their depression levels even further down. And they're looking at themselves in the mirror thinking, oh, I can't go out and get a job, or I can't make new friends, I can't meet a partner because of my teeth. So we can help liaise with the patient's mental health care team to get the patient in the best possible place for them to be able to deal with their day-to-day life and therefore improve their mental health. So working in multidisciplinary teams can be about individual patients, but it can also be about overall health promotion, about developing policies that we looked at the start of this session with the government health department to educate people as best as possible to allow them to be in the best position to be able to make the best decisions for them. We're not just about teeth, we're about improving people's overall health, which will in turn result in better oral health as well.